start having a dialogue and talk a little bit more about why it's important for all of us today to become really good healthcare advocates. This project came about through a lot of years of talking with individuals and families and focus groups around wellness and what people with developmental disabilities in particular need to do to master a really good system for wellness. It's a lot of challenges, and for those of you who are sitting in the room, I'm assuming you're either family members, individuals with disabilities, teachers, doctors, people who have a real vested interest in the folks that we know. So with regard to healthcare transition, that in itself, we could talk about it for days. It's really important to think about the complexities of young people with developmental disabilities moving from pediatric care to adult medicine, and what all of that means for them, not only in terms of medical issues, but also just with regard to confidentiality and the legalities for young people stepping into taking more responsibility and control over their own wellness. So just a couple things. Many pediatricians drop their patients between the ages of 18 and 21, and that scares an awful lot of families. One of the things that we'd really like to talk about today is how to develop a wellness journal and really focus in on the piece around communication. All of us need to be good healthcare advocates, so I'd like to challenge you to not only be thinking about this in terms of healthcare transition for young adults, but also be thinking about it for yourselves, for your parents, for your children, for people that you know in the community who, you know, acquire healthcare and perhaps have a variety of different providers, or undergoing a medical procedure, or have some type of healthcare process that they're going to be dealing with in the future. What kinds of things do we need, especially in today's world where resources are tight or non-existent? For a lot of young people, their insurance comes to them through their parents' insurance, and once they hit that transition age, that golden bubble of no longer being a student, that insurance stops, and then they need to either revert to their own resources or typically to Medi-Cal, Medicare, things like that. So we're really looking at a variety of issues impacting, and we want to be able to just kind of run through some slides. We have a lot of really nice resources to give to all of you today, and I wasn't kidding. We have 50 of everything, so if you want to, you can have to. For those of you who do need to leave, prior to the end of this workshop, please feel free to drop your card or somehow leave with us your contact information, and we'll mail you what we've got. There's supposed to be a disclaimer slide, and we're supposed to say that Robert and I are not getting compensated in any way from anybody for any reason, right?
Right, absolutely.
So we're not selling you any products today, but we will be talking about how you can create your own wellness journals.
Okay, thank you. I have another mic on, so I hope all of you can hear me. And I will go very, very slow. And again, if you have any questions, feel free to just let us know. But we are going to go straight forward with this presentation about the Wellness Journal. So today, we ought to ask ourselves this question: what is wellness? And of course, wellness could be an active process of informed decision-making that moves us toward a more fulfilling, healthy life. So the process of making decisions for yourself and others out there makes your life more healthier and more livable. That's what wellness means. It also means a balanced condition of good physical, mental, and spiritual health. But of course, when you maintain a proper diet, exercise, your habits and routines, you definitely get what we call the wellness. And let me explain these types of health. Physical health, like I was mentioning, is complete exercise like walking, jogging. That's an example of a balanced condition. Mental health, getting the services that you definitely need for your mental health condition that you have, so you can definitely function in your community or toward others. And spiritual health by means of yoga, meditation, Tai Chi, all that can definitely help you to definitely get what wellness is about.
So another definition, wellness is a multidimensional state of being describing the existence of positive health in an individual as exemplified by quality of life and sense of well-being. And a lot about what Robert was talking about, it really is overall and with regard to our physical, emotional, social, spiritual, intellectual, the idea of what our purpose is in life. So it's a very full and complex situation, and it requires more than just having healthcare providers tell us whether or not we're sick or healthy. It's more than having people in our lives talk to us about any illnesses, stress, or poor diet. A wellness is truly around, it encompasses our whole, it's a holistic view of ourselves. So with that, when we talk to people over the years, again, individually, within families, and certainly in a lot of focus groups, dealing with the issues of healthcare, people are afraid. There are a lot of fears and myths, not only that we have about our healthcare providers, but also that our healthcare providers have about us. And Robert, what were some of those things that we learned from people over the years that they were afraid of?
Okay, Sharon in just a second will read the provider part, but I want to go into the part about our fears and myths about healthcare that patients go through when they definitely see their doctors and their providers today. And the first one I'm going to mention, and I'll explain every one of these in detail so you know, is number one is going to hurt. When you definitely see your doctor, of course nothing is going to hurt if you definitely follow the instructions of what your doctors say. This is really, really important. But a lot of us think that if we go to our doctors and say it's going to hurt, they're not going to show up for those appointments. And we want them to show up for those appointments so they can definitely get the best health care and the best help there is. And then the second fear and myth is I do not know them. If you definitely know your doctor or your provider or your advocate that is out there, and you have a strong relationship between the patient and the doctor, you can definitely rest assured that you will definitely know them and they will take care of your health the best way they can possible. This is important. And next one is they talk about me without me. When you see your doctor, you have what we call a patient-doctor confidentiality, and mostly it's a written document that is out there that you sign before you see your doctor the first time, and it tells you your responsibilities and what you have to do to definitely get your services. So when they talk about me and without me, that's not true. They are talking about you and they're on your side to support you. All you have to do as a patient is to definitely, keep your appointments, definitely, take your medication that is out there, follow the guidelines that your doctors or the doctor's aide has, and you can rest assured that you will feel better in no time.
Robert,
yeah.
When young people have gone into their appointments with their doctors, and maybe their mom or their dad has been there with them, when they talk about, they talk about me without me. We heard a lot about people saying, young people saying that the doctor talks to my mom, or the doctor talks to my conservator, they never talk to me, right? And how important that is in order to help empower young patients, that it's really important to establish that communication.
Yes, and like Sharon says, it's very important that you always communicate with your doctors and your providers by what we call a team effort. That means that if you have a situation, have your families involved with it. Have, your families and your trusted friends involved with them. So the decisions that you definitely make will be the appropriate ones for the health care that you need. So Robert, what were
some more of the fears that people had, or the concerns that they had?
Sure.
When they go to the doctor.
Yes, I was going to get to the next bullet point. The next bullet point is I hear things that scare me. Sometimes the relationship that people have with their doctors, sometimes they're scared about, what the doctor is going to say, that they may not come back for their next appointment. But you can rest assured that if you have trust and confidence with your doctor and you keep that patient-doctor and advocate-provider relationship that you have, you can definitely rest assured that the services that you get will be permanent and you will keep that doctor and he will be with you no matter what. But like I was mentioning in the previous point, keep that relationship always with your family, relatives, and others. Now, the next one is they use words I do not understand. In the medical field, maybe all of you have heard of what we call medical jargon. Jargon is a term that means that sometimes doctors may write prescriptions, or let's say, for example, they may write, your treatment in a way you do not understand. It's very important that if you don't understand what the doctor is saying, clarify it. Get a second opinion from another doctor. If you definitely get that second opinion from another doctor, and you tell them, I want that, information to be in a language that is plain and clear for me to understand, you can rest assured that they will accept your request. And if not, after you do what we call the second try with another doctor, my suggestion is to get another doctor.
And the last two?
Sure. The next, I will be sent to live in a nursing facility or hospital. This is not true, because if you're definitely going to be
Robert, were those people's, was that somebody's fear though? That was their fear, that was their concern, right?
Yes.
And what was the last one?
Sure. Going to the doctor means I will die.
Right. So a lot of people had fear about if they went to the doctors, they weren't sure what was going to be happening.
Exactly.
Okay. So some of the other things that we heard about was actually from healthcare providers, and why that was really important to talk to them was because as people have concern about working within the healthcare system as a patient, healthcare providers today have a lot of concerns about people with developmental disabilities, and it comes from the fact that they're not sure they're going to be able to communicate effectively with people. They're not sure that they can trust what the person tells them and whether or not they're getting good and accurate reporting. They don't know necessarily about a person's disability. They don't have a lot of information or firsthand experience. Always go over time. Always go over my 15 minutes with people, and that's very frustrating. I mean, doctors are booked. If we have any doctors in the room, holler out. They usually have anywhere from 20 to 30 patients that are booked on their calendar each day in 15-minute slots. So they have to move really quickly, and inevitably people who have some significant either healthcare issues or disability concerns, then they're going to usually go over that 15 minutes, which behooves us then to be really prepared and well coordinated with our healthcare providers when we go in. People with disabilities have no resources, and people with disabilities are safer in medical facilities. For those of us who've worked in the community, assisting people out of institutions and developmental centers and skilled nursing facilities where they've been for a good chunk of their lives because of medical issues or disabling conditions, helping people to live in the community, there's a lot of education that needs to happen back and forth. Us community folks need to learn from the medical folks and vice versa as to whether or not how somebody with complex medical issues can live a very safe and full life in the community. So creating your own wellness journal. Some of these points included...
yes. And now we're going
to run through the headers.
Sure. And what we're going to do now is we're going to get to the focus of our presentation, and it's called Creating Your Own Wellness Journal. And let me go to every one of these points quickly. The first is called person-centered information. That's information that you center yourself as a person. Your health and wellness history, the history of your health and wellness that you currently have. You need to have communication. That's always a key in your provider-patient relationship. Tracking your health, knowing your symptoms, what you have. Knowing your healthcare providers, knowing them in case you definitely need services from them. You create a wellness team, a team that is out there to definitely give you, the medical attention that you need for a person that has a disability above all. And of course, you collect and keep the documents out there so you have the written proof that is out there in case something happens so you feel better.
So the person-centered information, because our resources change, we have new providers going from pediatric medicine where you might have had one doctor and a few specialists. You're now into adult medicine where you have many more specialists, and they're oftentimes disjointed, and we've all had that experience. It's very important for us to be thinking about the individual person and have them talk about What's important to them, what's important to know about the individual, what's important to the individual, what's important for the individual, and styles and preferences. I can give you countless examples of individuals who would be just fine walking through a certain appointment if fill in the blank could happen, or if fill in the blank, that person could come with them. It has to be communicated effectively, and one way that we can do that is for folks to make sure that they have all of their information current. You want to make sure that they have good emergency contact lists and to keep medication lists certainly current, but also to write a one-page, almost like a bio, about who the person is. Every time people need to go in and see new specialists or new providers, if they offered this up to them, they would have an opportunity to get to know them well from a person-centered perspective. In other words, if I wrote a one-page about myself, what I wanted my medical providers to know about me, then I would be able to really kind of cut down on that time initially. And for those of you who are thinking, well, my doctors don't communicate with me, they're not going to take a whole lot of paperwork, or how am I supposed to get them all this information? We have some ideas. So health and wellness history, keeping good records. It's really important that we go through the family history. We have to talk about previous illnesses.
Yeah, and like Sharon was saying, always keep the good records that are out there. The medical records that you keep out there are really important. Keep them for the rest of your life, because they will help you to definitely get the best treatment you can whenever you're sick. This is important. Your family history, the history that you have, illnesses or any diseases that you have, is really, really important, especially for people with disabilities and for providers and advocates. Your previous illnesses, I went through already. Previous surgeries, the surgeries that you had in the past in order for you to feel better. This is very important that your doctor knows about it, so if something arises again, you will get the follow-up treatment that you need for it. Knowing your allergies. This is really important. I'm a victim of, I'm right now a person who gets allergies. I get nasal allergies. I get food allergies sometimes, pollen. Know your allergies and how to treat them. This is really important. Knowing your interventions and therapies. Any therapies or interventions that you had with your doctor in the past and now, take a note of them. If you have any concerns for you to feel better, put it in writing, tell your doctor how you feel about it, and both of you can work together as a team. But also remember, like I said previously, get your family and your friends involved with this. This is important. Sure. Your dental, your OT, your PT, your GYN, etc. It's really important too. Always get along with them. That's what it counts. Your record, know your DME and your supplies. Know your durable medical equipment, your wheelchairs and your catheters and everything that is really, really important for your disability. Because if you know all that, your chances of definitely getting to where you want to go will happen. But always know that. And these 2 points are really important, and they go side by side. Record the medication changes. Anything you have on your medication, keep a log on it. One of the things that I've been doing in emergency preparedness, that I've been training people with disabilities, and they have told me, is always keep a log of all the medications that you have. And if for one reason that medication expires or something like that, try to get a new medication or consult your doctor for something that you can feel better about.
So communication is key, and how do you communicate best? I think it's really important that we all explore that for ourselves. What we do and how do we communicate? Are we more effective when we're talking to people directly? Do we keep good records? Do we use assistive technology to help us communicate? Do we do better working through an advocate? We need to be able to really identify for ourselves how we communicate best before we ever go and meet a specialist. Creating a wellness team, these are some things we're going to talk about today. Identify trusted team members. That's really important. I know just even recently I went with a friend to a medical appointment, and it was really important that there were 2 people there because things started happening very quickly, and without somebody else either asking questions or taking good notes, it's amazing how much you can miss. Identify trusted team members, ask wellness team for help, prepare in advance, ask questions and listen for answers. the more that we can do to prepare ourselves by using a wellness journal, the better off we're going to be. If we know we have a 15-minute appointment with folks and we might have 3 or 4 issues, we're going to have to prioritize those issues and really make sure that we're effective in our communication. Write down your ideas and concerns ahead of time. If you're working with somebody or if you know somebody who has an awful lot of challenges, it's really important to do that prep work. Going into a medical appointment cold is just really not advisable. And bring your wellness journal with you. Some people have boxes for every year of their life that's just chock full of medical documentation, prescriptions, refills, insurance paperwork, just, you can imagine, just boxes for every year. But what's really important is a working binder that you can use to keep. And we have, when you leave today, we'll be giving you some CDs that have a lot of resources on there, forms and templates already at your disposal that you can modify and customize for yourself. And then follow through with those next steps. You know, physicians are, even if you are on Medi-Cal or if you have a pretty good solid insurance plan, physicians are going to start charging people now when they miss appointments. And it's really already happening here in California. Folks are getting letters, hey, you know, from UC Med Center, you know, we were expecting you for an appointment on this day and this time. You need to call and change that with us. Otherwise, next time you will be charged. And those are pretty significant things for a lot of people who aren't accustomed to doing that. So it's a relationship that's one that really requires an awful lot of work and respect going back and forth. And one way we can do that is through tracking our health and keeping it simple and accurate.
Yeah, and when we track our health, this is an example of a wellness journal. We will have CDs for you at the end of this presentation, so you can go ahead and follow up what Sharon has said with this. But of course, when you track your health in the wellness journal, you keep it simple and accurate. Keep it the most simplest and accurate there is to tell about your healthcare conditions, how you feel, and what kind of steps you want to do to prevent it. You find or create your own log. Finding or creating your own log is really, really important. And keeping a calendar where you chart everything you have in your wellness journal, such as, for example, your food and nutrition, what you eat, your inputs and outputs are important, your routines of your behaviors that you've been having in the past, now, and in the future, your exercise and activity charts, the charts that you have to do better exercise, better activities, better wellness conditions that are out there, which are spiritual, emotional, and others. The mental health and feeling scale, the scale of your mental health, what you have, and your feelings. Any activities of seizures, it's very important that it be done in the wellness journal so the doctor will know. The monitoring of your blood sugar to see if you have diabetes type 1 or 2. This is very important that the doctor knows this so you get treatment. A lot of us don't know about this, but the wellness journal will set an example for that. The medication management, managing your medications, how to take them, how to feel better. This is really, really important. And the pain management, the management that you have for any pains or aches or pains, that also can be part of your wellness journal. And also, don't forget to put your month, your year, and track it on a daily basis. This is important.
And obviously, if we all did this, we would have very little time for living because all we would be doing is writing in our journals and tracking all of our information. However, if I had diabetes and epilepsy, it would probably be very important for me to track my blood sugars, my seizure activity, and my medication.
Right.
And my food. I mean, you know, you can imagine, for those of you who know folks who have some pretty complicated medical needs, one of the things that keeps us all healthy and with the ability to live successfully in the community is to be able to track and monitor our bodies and our wellness and what we need. It goes beyond even just what information we're going to be giving to our healthcare providers. A lot of it is just for good, successful daily living. For people with developmental disabilities who are at risk for no longer being able to live in homes of their own or live within the community due to medical issues. I've met far too many people who have ended up at the age of 25 living in the back end of a skilled nursing facility for 15 and 20 years because they were diabetic. Because they might have cerebral palsy, but they were also diabetic. And there wasn't a way for them to figure out, because they didn't have family and resources, how to live effectively in their own home and to do so safely. So it is a real issue. And so obviously tracking our health, it is bigger than just what we say to our doctor. It's also about our ability to maintain and empower ourselves to maintain control over our own lives, and to, for those who need to do that with a team. And we're going to talk a little bit about the team. Knowing your healthcare providers, it's really important. And for some people, again, who have a lot of medical challenges or different types of disabilities, they know a lot of people. They have a huge team of medical providers that they work with. And not all of those folks really communicate well within themselves, which is why a wellness journal is so important. We suggest to people that we collect business cards, and you'll see some examples up here for those of you who want to walk forward at the end to just kind of see, those plastic business sheets. It's amazing to me when people track and have wellness journals for any length of time, how many of those sheets just get full within 1 year of all the different providers that they have. So collecting business cards, keeping them informed, meaning when you have a change of address, when you have a change of medication, don't just assume that your GP has informed your gynecologist or your gynecologist has informed your physical therapist. It's not going to happen. We have to take responsibility for those things and stay on top of it. Making our appointments, we really, it's more than just scheduling our appointments, it's actually making our appointments. We talked about that a second ago. It's real important to keep a calendaring system, obviously, especially if you're someone who has a lot of different appointments each month. Ask about email. We're finding that technology is becoming such a great tool, and especially for our young people. They tweet and Facebook and all of those other things that I'm still wishing I had my 8-track. But email is a wonderful tool. I email my physician, and it's a great opportunity to be able to just get some questions answered, or call in prescriptions, or email in prescription requests. Or do those kind of light follow-up things that don't really require you to go all the way down and have a doctor's appointment, but in fact you can go back and forth. Especially for people who are monitoring and journaling and keeping track of blood pressure, things like that. Your doctor wants to see those every now and again, so it's really nice to be able to email them to them. Remind providers to CC. Your medical records are your medical records. Individuals have a right to put that in writing and request those records. And for those of us who've done that for our children or our loved ones or the people that we support, we literally do have boxes of all of those things. And what's great is that you have a real history of who the person is and what they've gone through, which is essential for things as they come to us through the years. But reminding your providers to CC and making sure that your GP, for example, knows the list of the other 10 specialists that you see. Don't forget the pharmacist. The pharmacist is such a handy professional with regard to our overall wellness and our healthcare system. They are the ones who know all about questions that we have about how medications work together, side effects, things like that. They're also the folks who know about prescription saving programs, and free products and how to access a lot of things. If you ask your doctor, 9 times out of 10, they don't know those things. But if you ask your pharmacist, is there a way that I can save, I'm having to spend 20% or $40 copay every time I need to get this medication, your pharmacists are the ones that have a lot of that information and where they can help you to get those things to offset those charges. They're also the ones to talk to about medication accommodations. People have trouble swallowing, get your medication in liquid form. People have, a tough time taking medications because there's, 15 and 20 bottles to choose from. You can talk to them about putting them together in bubble packs, which is a great system for managing medication throughout the day. So really work with the pharmacist. Get to know the pharmacist just as much as you do your other specialists. Schmooze staff. That was one thing that was really important for a lot of us, is that we just kind of go in there cold, like we do when we go and get our car work done. Yeah. And the people behind the counter who schedule our appointments with us, who take our blood pressure, the physician assistants, the diabetes nurse who comes in to talk to us for 2 minutes about how our diabetes is going, all of these people work very hard, and they have really important jobs to keep us up and running. And one of the things that we found, especially during times when we need an awful lot from our providers, So if we did a good job schmoozing the staff, we can get those first thing in the morning appointments. We can get those Saturday clinic appointments. We can get those records that we need in order to take to the next doctor a little earlier than we typically would have gotten them. And we get to know people on a first name basis. What that does for the people that we know, the young people with disabilities or anybody else that we know who may be somewhat vulnerable and not a great advocate, is it works on those relationships, those person-centered relationships, where I can go in and talk to Sue behind the desk, who checks me in when I go in and see my doctor, and then I also know Joyce in the back who does the billing. And because I'm getting an awful lot of medical bills, I can really work with Joyce and she works with me, and instead of sending 5, maybe we work together on getting them down and streamlining them. It really is the art of schmooze. And if you can do that with people, and we do that in a variety of ways, you know, one flower that you pick out of your yard and you bring it in and you hand it to them at the appointment works wonders. For those of us who have, you know, pre-op and a lot of medical conditions that are pretty intense, and we're working with discharge planning teams at the hospital, things like that, maybe sending a bouquet of flowers works. We've been known to bring lattes, we've been known to do whatever it takes to tell people thank you for the job that they're doing. And what that does is that they remember then the individuals that we support and know. And because of that, their healthcare relationships are just stronger for that. And again, these are important relationships. Our relationships with our doctors and our specialists and all of those people that we know in our medical world are very important. They keep us up and they keep us going.
Okay, so now the next part of my presentation is called Create a Wellness Team. So here's some questions that you need to know. Who do you trust? Of course, you gotta trust that client. You have to trust that doctor-provider-client relationship. This is really, really important. Get your family relatives involved, your trusted friends, anybody that can help you with your medical condition. This is really important. Who gives you the good advice? I already mentioned that. Who supports your decisions? The decisions have to come from you. If you definitely really want to get the best health care that's possible, you need to take that first initiative as an advice to see your doctor and get treated. If not, the condition gets worse. Who helps you when you need it? I mentioned that already. And who shows up when asked? It has to be you first. But remember, always have your family and your friends there with you to support any medical decision that is out there. And of course, ask people to join your team. I mentioned that. You plan your routine team meetings, any team meetings that are out there, plan them, but plan them accordingly. Let's say, for example, if you have a doctor appointment within 2 weeks, try to keep that appointment, because like Sharon says, if you do not keep that appointment, a lot of clinics in California are starting to charge for services. And even in my case in Los Angeles, I just got into an adult dental HMO, for example, that if I don't keep my appointments, I'm getting charged for it. So plan those routine team meetings. Those are really important to create that wellness part. And of course, the accountable action steps. Take the steps that are out there to get the best health care for you as a patient, and for the advocates and doctors that are out there, so the patient-doctor relationship will always be strong.
And some people, you know, obviously there are a lot of us out there who, if we just had one good healthcare advocate in our life, you know, for those of us who are older, it may be that person who's on our advanced healthcare directive. For those of us who have a lot of challenges and needs, it might just be that one person we take with us into the doctor's office. If I'm not reading and writing, I need somebody in there to make sure that my questions are getting answered and that we're writing down all of the answers that we need. For a lot of the folks that we know, they may in fact not have family, or they may not have a lot of friends. And so it's really about developing relationships, again, with, like Robert said, the people that you trust and the people who you know give you good advice. That can come from a variety of locations. There are people that we know who have 5 and 6 people on their wellness team. Now, this does not necessarily include their medical specialists or their medical providers, but actually people who need to know a variety or know specifics about the individual who has a variety of healthcare issues. Your regional center, they might consider their service coordinator somebody on their wellness team. It's really, for a lot of folks, it may just be a partnership. It may just be that one person who they've identified as a good healthcare advocate for them, that they can prepare in advance for appointments, that they can talk about what they want to get out of that appointment. It's an essential part of people staying well. For folks who have a lot of complicated needs medically, it's really important that they have more than one person on their team, because a lot of effort goes into that. You might have one person who collects all of your records and keeps them all organized for you. You might have one person who is good at going with you to the appointments and being your advocate. You might have one person who specializes in durable medical equipment. It's really important when you go in and see your provider and you need them to write prescriptions on your power chair or your walker or your cane or your hearing aids or whatever, you bring all that equipment with you. That can be a real struggle for some people. So it may just be somebody who has that expertise. So collecting and keeping documents. Requesting medical records, again, that's within your right, it's within the law. You put that in writing and you provide that to them, and they are, expected in a timely fashion to provide you with your medical records. Some of the reasons that we want to collect all of that is obviously we do want to review them for accuracy. For those providers who work within a good IT system through an HMO or through a hospital, they're able then to collect all of that information and share it, but you do want to make sure that it's accurate. I was just in a medical appointment yesterday with a woman I've known for a long, long time, and part of it is they keep calling her on the telephone and reminding her of some upcoming appointments. She's got some healthcare issues today that are new, so new offices, new departments are calling her. She gets really frustrated because she doesn't do well on the phone. She cannot remember who you are. She's not going to hear your name effectively. She's not going to be able to write down what you said and when you want them there or when you want her there. And so one of the things we had to do was change the phone number so that all of those calls will now come to me, and we can just organize them and then we can talk about them together. It's simple, but it's really essential, because otherwise she was starting to miss appointments and the other folks in her life weren't really clued into what was going on. There are your resources to answer questions. Your documentation is essential for you as a parent or as a person on someone else's wellness team to help answer all those questions. You really do want to make sure that the young person or the individual that we're talking about is really empowered to understand their own health care. And one of the ways you can do that is by reviewing their wellness journal with them and making sure that they understand about their own health care. Emergency preparedness, emergency rooms, if for those of you who've spent any time in them, and for some of us we've spent a lot of time in them, they don't have the same records that your GP's got or your specialists have out in the offices. And so it's really important. You can't rely on emergency rooms to know the individual that you're supporting, even if they go in there on a weekly or a monthly basis. They kind of like throw all those records out and start anew, and not everything's in their computer systems. So it's really important to bring your wellness journal for emergencies. Appeals and coverage. Boy, if you don't have documentation, you're not going to get anywhere with insurance companies and those folks that you want to appeal decisions sometimes because they didn't go your way. Staying organized, keeping, again, we were talking about boxes and systems. There's a couple things to think about. The idea is that you want to be able to stay organized and customize your own system. You can go out and purchase medical, commercial medical record organizing systems. You can purchase those. They're pretty costly, but they come with nice forms and a nice container, and you can fill them in. Part of what happens with a lot of that, though, is that over time, you have to continually buy replacement pieces. One of the things we really encourage people to do is to get creative about who the individual is, that this is their wellness, think about who they are, put together some very simple binder systems, and you can come up and see these. Certainly, we have wellness journals. Back in 1999, our Out to California Regional Center put together a really nice kit, and these are still available, and they're fully downloadable. And a lot of the forms that we'll be giving you today are on here. The idea is that as things change and modify, some people who have great IT skills may in fact want to be able to put all this on the computer, which is wonderful. And then you have an opportunity to just update as you go. For other folks, it's going to be just the same 3-ring binder system with no paper. That works too. As you're getting medical records from your providers, you're 3-hole punching them and sticking them in binders, or putting them in boxes and labeling them for the year. Whatever works, works. And for some people who have a lot of challenges, you can get, really creative, but the idea is that you want to keep everything and kind of keep it in a system that works well for you.
And of course, embracing your wellness. One of the things you should definitely do to embrace your wellness is to stay active. And I'm going to mention the things that you can do when you take back directly to your homes today. First of all, attend community lectures and wellness workshops. In communities where you live all across California and around the country, they have a lot of community lectures and wellness workshops that you can learn how to have emotional, behavioral, and other kinds of health. My advice is to take those courses and you'll feel better about yourself toward others. You enroll in the wellness classes and become more informed. I mentioned those. If you have opportunity, take Tai Chi, yoga, anything that you feel good about, take them and put it into practice. You'll feel better about your health, and you can rest assured that you'll have a very productive and good life. Make time to talk with your wellness team. We talked about this already. Your wellness team is your doctor. It can be your regional center. It can be your provider, your advocate, your close family, your family relatives. Anybody that you can talk about your condition and how you feel is important. And we're stressing this out in this presentation again. Of course, you meet and talk with the friends you trust the most. Friends that support you and don't let you down. You can definitely meet and talk about, your wellness, and they will be there to guide you no matter what. And of course, take 5 minutes each day to think about your health. One of the things I have done where I live in Los Angeles is that I look at a mirror before I start the day and I say to myself, what I have to do to start, feeling good about my health. It has helped me a lot, and I can definitely rest assured that I'm enjoying my life to the fullest. So take 5 minutes each day in any form you have to think about your health. And we'll leave you with this last question. What will you do to stay healthy and well? Ask yourself that question. Because once you know the answer on how to stay healthy and well, you can definitely rest assured that not only you're creating the wellness journal for you and others, but also you'll feel good about yourself.
Just a couple of things about taking community lectures or finding wellness opportunities to learn. That's a big thing for young people in particular who are going to be going into finding adult providers, and their medicine and their healthcare needs are going to change. And so part of that is education and information. And I hear an awful lot from providers that people with disabilities are not good reporters. They don't know their bodies well. They don't have the information that they need. They're not able to articulate it the way that they need it in order to really prescribe or make effective decisions for their healthcare. And I think what's really important is that we think about this for not only our young people, but other folks that we might know, and how informed are we? And what do we really know about our medical conditions and our bodies and the things that we need as we get older? And so I really encourage you, community college classes are free for a lot of the folks that we know. And there's some great opportunities through that, through senior centers, through community libraries, community learning centers. There's a variety of classes that people can take that cost very little in order for us to learn more about ourselves. And so if there's a particular healthcare issue or a particular area of interest, encourage the young people or the individuals in your life that you have to learn more about themselves through that wellness. And meet and talk with friends. For a lot of the folks that we know where they are isolated, they don't have a lot of friendships or relationships with family members that are effective or healthy, it's really important that people have purpose in their life and that they feel that they are connected. I don't know about you, but I can learn an awful lot by sitting around over coffee with my friends as they're talking about their healthcare issues and their healthcare needs. And I think we all need that. I need to be able to share with them about what's happening for me. They need to share with me what's happening for them, and that's how we support one another. People with developmental disabilities really need that opportunity as well. And so if you're looking around people that you care about in their lives and you see that they're fairly isolated, that's going to impact their wellness, and potentially that's going to impact their ability to have really healthy and fulfilling lives in the community. So it's definitely something to look at. But we like Robert's question, so what will you do to stay healthy and well? And again, we're concluding our presentation. We know it's the last workshop of the day and that you all are probably brain dead from all the things that you've learned and We just would love to know if there's any questions or opportunities, and at that point you can come up and take all this good stuff home.
Yes, ma'am.
I just recently needed to become involved with my disabled father's care. And I was wondering, to become part of this wellness team, do doctors generally require some kind of permission or exchange of information for me to contact them or call them?
There's
about
a
this
couple
care.
things. Yeah, it's really important that you're acknowledged as a healthcare advocate. We have advanced healthcare directives, and within the CD that we're sending home to you, there's a variety of different tools that you can use or people can use to create their own advanced healthcare directive. And that, of course, is for people when they are incapacitated or unable to make decisions for themselves, that they have identified someone else to do that for them. Again, I have people in my world who tell me every day, "You're my healthcare advocate, right? You're going to make sure I don't end up in the back of that skilled nursing facility and that, that's where I'm going to go." It's like, you betcha. So you have to have that identified. The other is that everybody is entitled to a point of contact or a reference person. You can talk to this person on my behalf when we're here in medical appointments. They just need to honor that. Some providers ask that you put that in writing, but mostly it's just a verbal. And I think too, those wellness contacts are really important. I know for my mom, it was a matter of showing up. She was diagnosed with breast cancer, and every day we had to go in for treatments. Every day we had to, prepare for surgery, and we just did it in partnership. And I think oftentimes medical providers are, once they understand your role, they understand that you're there to be helpful and to fill in those blanks that might be missing, or to take good notes, or support them in their directions for patients. They're really very grateful that you're there. But it's that partnership.
Okay. Any other questions for us at this time? Okay.
Well, thank you all
Great.
for coming.
The UC Davis Mind Institute began in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, learning disabilities, and other brain disorders is helping children achieve their fullest potential. Please call or visit our website to find out more about current studies, our research team, and upcoming events.